have the misconception that treatment is just the medication, and I don't want to put my 7-year-old on medication. And I do agree with you in what you're saying of it can be beneficial for a lot, but I don't think that that's the only piece. I think that that's a very, very small piece of the puzzle. And then the real core work goes into a lot of this behavioral modification and exercises that we can teach our kids.
Right. And so there's obviously the formal treatment piece in terms of behavioral therapy or some sort of coaching, but also, determining what are you getting out of any sports that you're doing. Because, one of the things with, therapy, for example, is that, well, there also part of it is also sometimes addressing the stuff, like maybe it's not the core ADHD symptoms, but the other stuff that's impacted, like self-esteem or other things depending on the circumstance, or anxiety or other related, so that's also an important part of therapy. But sometimes, if someone's, let's say, doing some sort of treatment, they don't feel like they're actually getting at the core symptoms. That's where, re-examining, who are they working with? Are they working with someone that can actually address the direct symptoms? Do they need more of a coach based on what they're looking for? Just because there can be a difference in terms of what someone can address in terms of, working on direct self-regulation skills or planning out homework assignments. And so I think just understanding, like, what are you trying to get out of whatever supports you have, and where are you falling short?
So what is executive dysfunction, and, what causes that?
Sure. So it's interesting. So it's a term that's used sometimes. It's not a formal diagnosis. It's not a medical diagnosis. It's a term that's basically used to say that someone has a hard time with executive function skills. And executive function skills are, let's think about a car factory. So a car factory, they have a control room, and the control room manages let's say robots that put together the different pieces of the car to create the final product. Essentially, executive function skills are kind of like the control center of a human brain that basically allows you to plan, organize, get stuff done. Pretty much without executive function skills, you pretty much wouldn't be able to do anything. You wouldn't be able to plan out, how do I get food? How do I get from point A to point B? And so you really need those planning, organizing, getting yourself going skills. And the idea is, in theory, over time, people learn them as they get older, with the parents or caregivers, doing more scaffolding. So, giving more assistance when they're younger, and then gradually kind of pulling back on that to give them more independence as they learn how to do it themselves. The hard part is for people that don't really learn how to do it themselves and have a hard time, executing strategies that maybe they've been given. That's where it can cause issues. So really, I mean, almost anyone, but basically the idea is people can have executive function issues due to a lot of things. So ADHD, I mean, the way that I view the definition of ADHD, I think I would view it as, by default, if you have ADHD, because of the symptoms that, of course, in ADHD, you sort of by default have executive function weaknesses. But people can certainly have executive function weaknesses, or what you mentioned as executive dysfunction, without having ADHD. Anxiety can cause that, because if you're really anxious, you may have a hard time getting started and stuff, or you're so anxious you can't think straight, so you can't plan effectively. Depression can do the same type of thing in a slightly different way, or OCD. I mean, I feel like I've sometimes joked that find any sort of disorder that doesn't impact executive functioning, because almost everything that could happen really can impact someone's executive functioning.